Welcome back to Empowered. I'm Elizabeth Nemofsky. Perimenopause, menopause, and post-menopause is today's topic. Annie, before we went to break, we were talking about hot flashes. And you said that sometimes you can manage it with nutrition.
Actually, a number of lifestyle strategies that we can tackle. When it comes to nutrition, first and foremost, we're really looking at an anti-inflammatory diet. Once again, we're back talking about that. Less red meat, really no alcohol will help significantly with that. Flax seeds, also known to help, and what we call phytoestrogen foods, which basically mimic the effects of estrogen in the body. It's not the same, but it mimics. Foods such as legumes, soy will really be helpful for women to tackle hot flashes. Now, what's also known is that cognitive behavior therapy will really also help with hot flashes. For some women who cannot do hormone therapy for whatever reason, this is a great strategy to tackle. And then let's not forget movement. That is a gold standard as well to help hot flashes, and also your next topic, night sweats.
Night sweats, yes. So let's talk about night sweats. What can we do to minimize them, make them just go away?
Yes. So what we just talked about for hot flashes, also effective for night sweats. It's also important for women now to probably make some changes in terms of the bedroom setting, right? Much cooler temperature, sheets that are really cooler. There are also now pillows and mattresses that are cooling. So really helping women be more comfortable. And just like the dress code, having multiple layers, right? From that thin sheet to, getting a little warmer. That's going to help us in managing our comfort.
What about food-wise? Is it the same for, managing hot flashes, or is it different?
It is the same.
Okay. Okay. So let's talk about diet. Let's keep the diet going. So how can a balanced diet help manage symptoms of perimenopause and menopause?
Studies have shown that an anti-inflammatory diet will really help women because one of the factors is that anti-inflammatory diet, such as the Mediterranean one, really has a lot of fiber in it, right? Lots of leafy greens and fruit, lots of fiber, which will actually help us. It will also help us in terms of elimination and supporting gut health. Gut health is everything. I know we'll be talking a little bit more about that later on, but it's so important at this stage of life. The healthy fats also will support us in terms of mental health. So really critical to be changing our habits and honing in on a few more important factors such as more plants in our diet.
So you just mentioned mental health. I want to talk about the imposter complex, imposter syndrome. How can women trust themselves to take risk and then go after what they really want, especially when you were talking about brain fog and other things that we're going through?
Yes, this is actually an interesting thing at this time of life. What I observe is that midlife is an interesting and perfect opportunity for reflection. It's a great opportunity for taking stock of all the things that we've actually accomplished, the experience in all facets of our life, personal, professional. So I think that the number one thing for women is to actually realize, wow, look at everything that I have accomplished. And I know it's hard to do that, right? Because we have a tendency to just play it small. And then and that will actually give us a little bit of momentum for taking these small risks, which will give us confidence. When we take these, we step out of our comfort zone, that's when we get the rewards because we see right away how much it pays. It pays backwards. So I think that it's really a perfect time, midlife, for this renewal and for starting to really live the way that we actually want according to our values and taking and showing up in this world.
Okay, so just before we go to commercial break, I'm going to ask you a question. You can answer it, and then we can talk about what we can do about it. So in 15 seconds, Can menopause cause osteoporosis?
Absolutely not. Menopause does not cause osteoporosis, but it is a factor.
Okay, so when we come back, we're going to talk about what we can do about it if we are in menopause.